Imagine living in fear. Fear of being judged, fear of prejudice, fear of HIV infection, fear of stereotype, and fear of social and economic ramifications. For many gay men and men who have sex with men across Africa, this is an everyday reality. Tabo is a young person who faces this everyday reality. Stigma isn't just one thing. It can be internal, when someone feels ashamed of who they are, or external, being judged, rejected, or harmed by others because of their identity. I'm Toby, your I2I ambassador. Let's talk about what's happening and how we can be part of the solution. Self-stigma happens when gay men and men who have sex with men start to believe the negative messages they hear. This creates a sense of shame and guilt that can lead to depression, anxiety, and isolation. Sometimes this can also lead to suicidal thoughts and ideas. Tabo struggles with this daily. Many men like Tabo often feel rejected by their families and close friends, disowned, forced into heterosexual roles, or subjected to harmful conversion efforts. The result? Trauma, homelessness, and deep emotional wounds. In communities, gay men and MSM often face discrimination, harassment, wrongful arrests, and even violence. They're excluded from gatherings, denied services, and sometimes physically attacked, just for being who they are. For Tabo, even in healthcare and other public services, stigma is real. Gay men and men who have sex with men are often judged, refused treatment, or have their sexuality exposed without consent. Legal systems currently are also at the heart of perpetuating stigma at all levels, with laws that convict many people because of their identities. Legal systems can perpetuate stigma and can deter men from seeking healthcare and other public services. But here's the good news. Change is happening. All across Africa, individuals and organizations are working to reduce stigma and support gay men and men who have sex with men. Most peer-led programs have been acceptable and successful. Group-based interventions based on cognitive behavior therapy helped gay men and MSM feel empowered, resilient, and feel supported to deal with stigma. Family-focused programs provide family counseling and sensitization to help families accept and support gay men, MSMs, and their family members and friends. Community theaters are even being used to change minds and hearts. Healthcare provider training programs are equipping providers with the skills and sensitizing them to offer stigma-free and patient-centered care. While 22 countries in Africa have decriminalized same-sex relationships, and this is a step in the right direction, many social and structural barriers remain to equity and justice for MSM. It is highly important that there is a focus on monitoring and collecting data on stigma and ways to help reduce stigma in different areas. Data on stigma can help inform community-led advocacy and programs. Stigma isolates, but support and unity connects. We all have a role to play. Together, we can build stronger systems and societies where everyone, including gay men and other MSM, can live free from stigma and discrimination. When stigma is replaced with unity, when silence becomes solidarity, we build a future where everyone has access to justice, the right to health, freedom to live, and social protection. Let's keep learning, sharing, and taking action, because health, dignity, and respect belong to everyone.